The Klein Family Harford Crisis Center is a behavioral health care center that addresses mental health and substance abuse here in Harford County. It offers 24/7 care in a safe and comfortable environment. Join us in the next 30 minutes as we learn how this center helps us to strengthen the path to hope and recovery. I'm Kristy Breslin, and this is Harford MagaScene. Barry Glassman joins us now, the Harford County executive. Barry has been very passionate about this project, and it is the first of its kind here in Maryland. Barry, thanks so much for being with us today. We are so excited and grateful to have a facility like this in Harford County.
It's good to be with you, and it's great to talk about this crisis center, which, as you said, is the first of its kind in the state of Maryland. And what a great partnership between the county, the state, and Upper Chesapeake. And we even want to recognize Governor Hogan, who contributed $750,000 towards some of the build out here at the facility.
Barry, what does the Crisis Center provide?
Well, the Crisis Center is the first of its kind really in the state of Maryland, and a first for Harford County, but a partnership between Upper Chesapeake, Harford County, and the State Health Department. It's so unique in that it brings together three different parties to provide this service, and it provides 24/7 addiction, mental health services to the public. And we find that so often young people of all ages really have overlapping conditions, and it could be manifesting itself in addiction, yet they may have other mental health issues that are contributing. And for the first time in the county, there's a place where you can come any time of the day or night and get assistance.
The county has contributed $500,000 to the cause. Why did you feel it was so important?
Well, I know in one of your segments you're going to talk about Andy Klein.
Yes.
Andy came to me a couple of years ago before we even kind of thought of the concept, and asked if the county could put up some additional funds in addition to Upper Chesapeake, and if we could pool our money, if we put enough together, could we get a spot for folks to come for mental health and addiction services. So the county pledged $250,000 a year. We've put $500,000 in so far, and we have committed for an additional 2 years to provide funding to keep the Crisis Center going in its formative stages, and probably been the best investment that I've ever had to really give to the community. And when you look at the numbers that we can talk about, it's made a big difference already in its first 6 months.
What are some of the initiatives and some of the efforts that the county is doing to support the National Recovery Month in September?
So this month is really a chance for us to look back on all the things we've done through public information, investing in treatment, our peer counselors. I'm proud to say that Harford County has been a leader in responding to this crisis from day one, when we first committed county money to begin to partner with ACR to provide connections to get people treatment, to going to the middle schools, to working with the sheriff. We really have kind of made it a team job to get this done. So we're going to celebrate that, but also, you know, through our second chance job fair, and by tracing some of the folks that we've helped over the years. They've bought their first houses, they've been able to be reunited with their families. So we're going to celebrate that type of recovery, that what we've always said, that recovery is possible, that you can beat this thing. It is tough. There is no doubt about it. It is a lifelong struggle. But we have living proof that it can work with the right programs, the right community support, that you can turn it around and there is a light at the end of the tunnel.
Barry, a lot of people are worried about privacy. Can you address some of the privacy concerns?
The Crisis Center here is a very modern and professional building, so they follow all the national standards for privacy, all the HIPAA regulations, so I think everyone can feel secure to call the 1-800 number for assistance, but also feel safe to come here and have your privacy protected. We also have a mobile crisis team that if you call, if someone's feeling suicidal or really feels that they're at the end of their possibilities and they really need help, we can send a mobile crisis team to you privately to get those kind of services to you and support. So I wouldn't worry about that. You know, the other thing that we talk about is that mental illness, mental wellness is no different than a physical ailment. I have high blood pressure all the time, and many families struggle with many what we would consider normal health problems. But the fact is that mental health, whether it's depression, anxiety, all the other ailments that you suffer are no different, and I think part of our efforts is to get rid of that stigma too, that there's nothing to be ashamed of. If you need help or counseling, that's what it's for. And I've been a big proponent for 20 years to make sure, even through insurance, that mental health is covered the same way as my high blood pressure is. If mom and dad have a minor that needs to get help, a child, that they should be able to get access to care no matter what their age. And really the Crisis Center is the first fundamental step for Harford County to provide that access to care.
Now, Barry, for all of our Harford County residents out there, where exactly is the Crisis Center located?
Well, the Crisis Center is in the heart of Bel Air. I like to refer to it as there was an old bowling alley here.
I said the same thing.
A long time ago.
Yes.
Then there was an exercise, and it's across from the old auto auction.
Yes.
And
okay.
so it's a great building that we were able to kind of partner with the prior owner and Upper Chesapeake. And I think everything we've done has kind of been a partnership, even with the community. Of course, the Klein family and Andy Klein's dedication, and really, I think naming this or recognizing Andy is a special thing that we had to do. It's unfortunate we lost him so early, but he was one of the first early folks to recognize that need. I think it was his experience with Upper Chesapeake and learning about health care and access to care that he saw this need in the county.
Barry, thanks again. Really excited to have this here in Harford County, and thank you for your contribution to making this happen.
Thank you. Good to be here.
Well, coming up next, we're going to talk to some of the community partners and find out how the Crisis Center is helping to eliminate all the chaos of the emergency room and what is the difference. Stay with us. Rod Kornrumpf is the Executive Director of Behavioral Health for the Upper Chesapeake Healthcare System, and he is here today to tell us about the many advantages that the Harford County Crisis Center will bring to our community. Hi, Rod.
Hi.
Rod, who are some of the partners that helped to bring the Crisis Center to fruition?
So truly it was a county-wide effort. We started with Upper Chesapeake, Harford County government, so Barry Glassman's office, the county executive. We also had the county health department, we had the county core service agency. So what that does, those last two, really brings together both the mental health and the substance use services. And so we spent a lot of time, really over a good solid year, walking through what the services needed to be, what the gaps were in the system, and how could we answer both of those sort of things. So that's where we got to a crisis center, a call center, where somebody could call 1-800 next step and actually get another person on the other end of the line, a behavioral health professional who could help them walk through the system. So all of that was through this partnership, not one entity could do it by themselves.
Why is the center so important to the hospital, and what gaps does it fill?
So from a hospital standpoint, hospitals in Maryland are under a Medicare waiver, and I won't bore you with too many details, but the long and short of it is the goal is to create more community services and keep people appropriately out of the deeper end services, keep them out of the emergency room, keep them out of inpatient beds if that's not where they need to be. As a society, as a country, we've created the emergency room as the safety net, right? If you don't know what to do, go to the emergency room.
Right.
So what we're trying to do in Maryland is not use that as the first door for service if you don't need it. So for us, creating a crisis center will take a whole boatload of people who only used the emergency room before, bring them to a center that's more appropriate to their needs, and keep them out of those deeper end services. Same thing with trying to keep folks out of an inpatient bed if they don't need to be in one.
With the addition of the crisis center, is there now more new or extra services that the hospital is able to provide?
I think what's important is what we don't have to provide. Okay, so if we can keep somebody out of the emergency room and really just use that for life-threatening medical emergencies, that frees up the doctor's times there, that frees up the nursing time there to really focus on what they've been trained to do, which is look at the heart attack, the compound fracture, the stroke, those sorts of things, and free them up from the behavioral health folks who maybe are not life-threatening issues, and so they sit there and they wait and they wait and they wait. So the benefit to the hospital is appropriate people going to the emergency room. The benefit to the community and to folks with behavioral health illnesses, disabilities, is that they can get service designated for them, designed for them, in a location that's designed for them.
Rod, let's talk about cost, because obviously that's a factor. What is the cost of the emergency room over the cost of the crisis center? How does that compare?
Good question, and that's too is a perfect example of how it is a benefit. So the crisis center here probably is about 25% of the cost of an emergency room for the same degree of time or same degree of service. Because when you're in an emergency room at a hospital, you're not just paying for the emergency room. You're paying for all the rest of the building that emergency room is in, overhead. You're paying for the cafeteria to some extent in those emergency room rates. Here, we don't have that overhead. This is a service just located with behavioral health, no cafeteria, none of those big brick and mortar kind of buildings, so our costs are exceptionally less. It's a manpower cost.
Rod, thank you so much for being here, and this is such a benefit to our residents here in Harford County.
Oh, my pleasure, and thanks for coming, because the only way we get people here is through word of mouth, is through efforts like this, and we really need to get people to use this and as an alternative to the hospital services.
Absolutely. And the Crisis Center has many different amenities available to the public. Coming up next, we'll hear more about the crisis hotline and the mobile crisis unit. Jessica Kraus is the Director of Core Services, and she is here to talk to us about how they are partnering with the Crisis Center. Hi, Jessica.
Hi, thanks so much for having me.
Jessica, what is the Core Service Agency, and what exactly do you do?
So the Core Service Agency, back in the mid to late 1990s, all the jurisdictions were responsible for establishing a Core Service Agency, and those agencies act as the local mental health authority. We are responsible for systems planning, managing, monitoring of all the mental health services that are publicly funded, so individuals who have Medicaid insurance.
What behavioral health resources are available in Harford County?
So besides the ones offered here at the Klein Family Harford Crisis Center, we have a wide array, ranging from traditional outpatient treatment to short-term intensive day programs. We have so many grant-funded programs here in our county, such as a peer-run wellness and recovery center in Aberdeen. We have respite services for children and adolescents. We even have the Maryland Employment Network housed in our agency, and they help individuals who receive Social Security benefits return to work. And they serve all of Maryland, not just Harford County. We have so many services, it's so hard to name them all.
Right.
But if someone wants to check out our website, www.harfordmentalhealth.org, or even give us a ring, we would love to help anyone and everyone direct them to an appropriate service.
The best part about this is that it's 24/7. So tell us about the crisis hotline and the crisis mobile team unit.
I am so excited about this. I can't believe we were able to pull something off. We being all the partners that came together to make this dream a reality. We Had mobile crisis team services here in the county, but nothing 24/7, 365. So back in October, our agency contracted with Affiliated Sante Group to begin providing those services. So like you mentioned, we have the 24/7, 365 behavioral health crisis hotline, which is 1-800-NEXT-STEP. Any crisis, no matter how small, anyone can call. You're going to get a live person on the phone, someone who's going to listen, provide support, and then even connect you to resources or services here in the county. That may even be the mobile crisis team. They will meet an individual wherever they are in the community. So if you call 1-800-NEXT-STEP and you're at work or school or even your home, they're going to come out and see what's going on, talk to you, make you feel better, and get you connected to services. And
Jessica, what advice would you give to someone that is suffering from a mental health crisis or has a loved one that is suffering from a mental health crisis?
they should come to the crisis center to get the help that they need, get the support they need, link them to resources and services once they walk out this door. You know, we see it all the time, recovery is possible. This place instills hope and a brighter future.
Jessica, thank you so much for everything that you've done and for helping to get the message out that recovery can happen.
Thank you.
Now, coming up next, Andrea Pappas joins us to talk about how big the mental health crisis actually is in Harford County and the many steps that we're taking to address it. Andrea Pappas is the Behavioral Health Bureau Director, and she is here today to tell us about the many strides that they are taking to help combat this big problem here in Harford County. Hi, Andrea.
Hi.
What kind of trends have you seen in the past few years regarding behavioral health, and how is the Klein Family Crisis Center addressing those needs?
So I think the past couple of years we've seen such an influx of fentanyl that I think kind of has forced us all to take a different approach in our treatment of individuals, because it requires a lot more, I think, close monitoring as well as a faster approach to things. So that can change the way we do treatment. It can change that, trying to fast track people into inpatient or intensive outpatient programs. So I think with the Klein Family Crisis Center kind of being in operation, it helps fast track those people in order to get them the services and the entry into treatment that they need in order to then transition to whether it be inpatient treatment or even more outpatient programs in the community.
How does the Crisis Center complement other services in Harford County? And what kind of gap does it address?
So I think one of the biggest ones, and even with our agency, we have an outpatient clinic through the health department, and we're only open, 7:30 to 5, and then some evening hours. Well, unfortunately, people could need help at 7 o'clock at night or 8 o'clock at night, and the crisis center is able to kind of bridge that gap. So if someone's in need of treatment at that time, they can come in and get the help that they need. So for us, that's beneficial to kind of have that relationship that we can utilize the crisis center as not only as a referral for people to come into our program, but also utilize as a resource when we're not available.
Andrea, in your opinion, how big is the mental health crisis here in Harford County?
I'd say it's pretty big. I think it's bigger than we realized. I think that even looking at some of the stats that have come out of the crisis center, there's a lot of people presenting that are from Bel Air, which I think was surprising to them. They thought that maybe it would be in other pockets and other jurisdictions, but a lot of it's in Bel Air. And I think it's a lot of this mental illness and addiction that wasn't really addressed, or that we knew the extent of it. And now with the crisis center, I think we're actually bringing a lot of things to light, which is good, because I think people are getting the help and the treatment that they need.
Now, is the center open to anyone?
Yes, yeah, it's open to anyone. So the nice thing is they're able to treat someone that has insurance, that doesn't have insurance. I know the health department even has someone here that's able to enroll individuals in MCHIP or medical assistance, so should they not have one, they can enroll while they're here, as well as any type of insurance that someone has. And it's nice too that if someone is unable to be treated here or is too severe, they do have the hospital right down the street should someone be, too intense at this level to treat.
Andrea, thank you so much for being here today. Thank you for your expertise. Thank you for your guidance, and thank you for your passion.
Thank you.
Now, coming up next, we're going to speak to Janie and Sarah Klein about Andy's legacy and how they plan on continuing it. I'm now joined with Janie Klein, a very familiar face here in Harford County. The Klein family has supported the community in so many of their efforts and have been instrumental in bringing the Crisis Center to Harford County. Hi, Janie.
Hi, Kristy.
Janie, what would you like us to know about Andy? What kind of man was he?
Andy cared a lot about the community. One of his taglines was that he wanted to make God happy, and he always wanted to make the world a better place. So he did that in a lot of different ways, and I think the hospital was one of his pet projects up here in Harford County, although he worked on national campaigns for organizations. He was really involved in John Carroll, Harford Day School, and really any organization that asked him to get involved, he put his whole heart into it. He was a really authentic person, which I think inspired people to join him in whatever endeavor he was working on. And he really worked hard. When he was working on a project, he put his whole effort into it. And he really worked hard to bring it to fruition.
Can you share with us why the Crisis Center and mental health resources were so important, Andy?
We have a friend who's an addiction doctor, an addiction specialist, and he began talking to Andy about the process of addiction and what caused it and how he felt like it could be addressed. And really, we knew there was an opioid crisis, but you just don't even know where to start. And this was a starting point he brought to the board. And as the hospital board discussed it, I think they realized that it wasn't only the opioid problem, but it really came down to that mental health was really the problem in the background that drove a lot of the opioid crisis. So you couldn't just attack people using drugs and alcohol, but you had to really come back to where the problem began, and that was mental health. So he was at a board meeting, and as Lyle Sheldon said, he just kept chirping away at them till they finally agreed to address this, and he and some of the board members paid for a consultant to come in, and through that consultant, I think they narrowed down the scope of the project to encompass the mental health aspect of it, along with treating the addiction.
The Klein family has been a tremendous partner in our community, but it takes a lot of people to make this happen. Can you tell us about some of the other partners that really helped to make this dream a reality?
Well, Andy was the visionary behind the Crisis Center, but he was such a good motivator of people that his brothers, who were also involved in the business, Michael and Howard, decided to fund the Crisis Center. And when we came to the dedication, we're so moved by the work that they were doing that they added additional funding to support the Crisis Center. So his whole family really worked together on many projects in the community, for the hospital, for schools, and for different programs in the area.
Janie, thank you so much, and thank you for telling us about Andy. What a wonderful man. We're very lucky to have you and your family, such giving people.
Oh, thank you, Kristy.
Well, coming up next, we've heard from Janie. Now we're going to hear from Sarah Klein about what her father, Andy, was really like. Sarah Klein of Klein's Family Markets is here to talk about Andy and how she continues to make sure his legacy stays alive. Hi, Sarah.
Hi, Kristy. Thanks for having me.
Thanks for being here. Now, Sarah, your mom said not to tell us everything, but tell us what you would like us to know about your dad.
My dad was quite the character. I was a middle child, so I always felt neglected. But my dad was always there. He was really an interesting person, I guess. Like, whenever we needed anything, my mom was like, no, we just went to Dad. But he always got involved in our school projects. He might not always been there to pick us up from school, but he dropped us off every day. And he just always wanted to make sure that we had what we needed. And he wanted to make sure we always did well. If we were struggling with something, he was always willing to say, okay, let's see really what the problem is, what can we do? And he just wanted to help us do better. And you wanted to be like my dad. He was kind of somebody you looked at and was like, I could do that. And for me, I always wanted to work in the grocery business, so I went into college straight as a business major because I just wanted to work in the grocery store. I just wanted to be like my dad, so I kind of always tried to do what he would do, and maybe I have a little bit too much of me in him at times, people might say, but he really was just somebody that you wanted to talk to. I think back now to when I was a kid, and he would work all day, we'd go to school, and we would want to go to a Maryland basketball game, and he would always just say yes. And now I'm like, I don't know how he did that. I'm tired after work, and he would just drive us 2 hours down the road to go to a game.
What are some of the ways that you plan to carry on Andy's legacy and his work?
About 2 or 3 years ago, my dad started getting me more involved in community organizations. And I don't know if they asked him to be on boards, and he was like, no, I'm getting older, I don't want to, or he kind of said, let my daughter do it. But the past couple years, he's really gotten me more involved in different organizations and boards that I'm on now, and really helped me make relationships in the community. And somebody after he passed away said, I didn't really understand why your dad wanted you to work with us. Like, you're a younger kid, like you don't need, but after that we realized why he wanted us to be together and the connection that we had and how much they've helped me grow just as a person, just being around them. And he, like I said, leading by example, I kind of just followed in his footsteps, and people didn't really say, oh, well, you're not your dad, you can't do this. They kind of said, okay, we'll take you on and we'll help you do this. And everybody has been great in helping me learn the path of what I need to do, or any struggles or questions I have, I know I can pick up the phone and call somebody.
How do you think your dad would feel about the success that we have seen so far with the Crisis Center?
I think he would be just happy. He would just be overjoyed with it. Right after he passed away, I saw a fox in my backyard, and I thought, oh, it might be my dad. And the day that they were doing the ribbon cutting for the Crisis Center, I saw a fox run across 24, and I was like, what are the odds of that? So I think he kind of knew we were going there for the opening, and I think he was very visionary of everything he wanted, was kind of always over the top. But he just had this idea in his head, and if he had that idea, like, it was going to get done one way or another. He wasn't really going to take no for an answer. And I think having it open and running, he would just be overjoyed and just happy that he's able to give back more to the community. And it's not a monetary way, but it's actually helping people. And I think one of his big things was this was something that helps people across all of Harford County, not just people in Forest Hill or Bel Air, but it helps people all over in Aberdeen, Edgewood, Bell Camp. It doesn't matter where you are, there's a central location. I think that was one of his big things. He just wanted a central location that wouldn't judge anybody, didn't care where you came from. It was just there for you to have.
Sarah, thank you so much. Thank you to your family, and the memory of Andy will certainly live on in our hearts forever.
Thank you.
Now, as you have seen today, this is a big step for Harford County. The Crisis Center is going to help so many of our residents. We would like to dedicate this show to the memory of Andy Klein. Undoubtedly, the biggest champion for the Crisis Center was Andy Klein, president of Klein's Family Markets. Andy was tragically killed in March 2019. He was a visionary leader, a volunteer, a philanthropist, and a friend who full-heartedly supported Upper Chesapeake Health's community health care mission. His dedication to the organization included his service on the UCH and its hospital's board of directors since 2004 and the UCH Foundation board of directors since 2003. Klein served as vice chairperson of the foundation board since 2015 and was the founding chair of the Senator Bob Hooper House Board. He also served as an honorary chair of Your Health, Our Mission, Caring for Our Families Together campaign, where he was a visionary and leading proponent of the Crisis Center, as well as a generous supporter. Andy Klein cared. He gave of his time, his talents, and treasures to help his family, friends, and neighbors. He is deeply and sorely missed. If you would like to make a gift to the Crisis Center to support your friends and neighbors in crisis, visit uchfoundation.org/makeagift. I'm Kristy Breslin. See you next month on Harford MagaScene.